What's up, rookies? Welcome to another snippet on what pharmacists do. Here, we showcase what pharmacists do and explore inspiring pharmacy career paths. You've often heard me say that pharmacists don't just count pills. Pharmacists take care of patients. Pharmacists have direct patient care interactions and truly make an impact on those patients' lives. Pharmacists are an integral part of the healthcare system. And to back me up on that, today, I have Dr. J. Shubrook, and it's an unbiased opinion at that because he's not a pharmacist or a pharmacy student or resident or pharmacy anything. He is a family medicine physician practicing in Solano County and also a professor in the family medicine department at Touro University, California, College of Osteopathic Medicine. So thank you so much, Dr. Shubrook, for coming on. How are you doing today?
I'm great. It's a pleasure to be here, and what a great program you have.
Thank you. And shout out to Dr. Clipper Young for making this happen. Thanks, Dr. Young. I hope you enjoyed the interview. So, Dr. Shubrook, can we start by having you tell us a little bit about yourself? Why did you become a doctor, and how has that journey been so far that led you to Touro?
Sure. So, when I was a college student, I wasn't thinking about medicine. I was thinking, I was very much in the fitness space. I was thinking about physical therapy, but for me, it was always wanting to know more and wanting to know more. And in fact, I considered traditional allopathic medicine for a while, and it wasn't the right match for me. And one of my friends went to an osteopathic school and said, "This is probably what you were looking for, a little bit closer." And so it wasn't until after college I actually considered it. But I chose osteopathic medicine, and I initially chose family medicine because I like treating adults and kids. I like inpatient and outpatient. I wasn't willing to give anything up, and family medicine is best for that.
Yeah.
Yeah. And then Touro, I was at Ohio University for 23 years, and my practice actually went from family medicine to diabetes exclusively because of the incredible need. And Touro has a health professions campus, and I very much believe the necessity for team-based care. And it was a great platform to kind of work on how can we do chronic disease management better and build future healthcare professionals to be part of a team.
Okay. And I like how you mentioned in the very beginning how you always wanted to do more. And that's something I always tell myself and young pharmacists to always have that mindset of what can I do for others and what can I do more from where I am now to grow. And the answer to that question will always lead you to the next step and the right path that's meant for you. So I really appreciate you saying that. So the next question is, you are very passionate about interprofessional education and collaboration in healthcare practice. Why is that?
Yeah, so I think, there's a few things. I think, chronic disease management is one of the biggest burdens we have in the healthcare system.
Yeah.
And quite honestly, we don't do it very well in the United States. I think we are very much focused on symptoms, not management. And, the beauty of the healthcare professions is that we have lots of different people that come with slightly different perspectives and different expertise. And when we work together, we're like a symphony. When we work separate, we really don't get the kind of the best of the best. And so diabetes especially, but there's many chronic conditions where when we work as a team, we have more touch points with our patients. They get to ask more questions, they get to do more things, and then our patients get better care. And I think too many students only know their lane, right? They only know what they know. They don't know where they fit in the sympathy. And that's what we need to teach people.
Yeah. It's a synergistic effect to have everyone looking at patients from their own lens, but then putting that together as a team and really taking better care of the patient. As pharmacy students and new practitioners, we're often nervous about making recommendations to providers, nurse practitioners, physicians. Maybe part of it is that we're not so sure or positive about the recommendations we're making, but I think there's a kind of a imposter effect syndrome that we have that kind of sets us back from reaching out and working with other healthcare providers in the team? What factors do you think need to be in place? What factors influence better collaborative practice in healthcare?
Yeah, well, yeah, I think that's a rather complex piece. I think that there are norms in education that probably aren't really healthy norms, right? We tell
Okay.
people this is
Yeah.
what you do, you don't do that.
Yeah. Yeah.
I know that there's some necessity for kind of limits of our licensure, but that is a safety issue, not a practice issue. And quite honestly, it was never intended for any one of us to do this in isolation.
Yeah.
So
Yeah.
it's crazy for me to think that if I was the only person seeing someone, that I could meet every one of their needs. It just
Right.
doesn't work. And
Right.
there's no one on the team that quite honestly can do that. And so I think that, again, recognizing that if we utilize each other's strengths,
Yeah.
which means you have to trust each other's strengths, which means you have to trust your own strengths, then we can really be part of a team. And
Yeah.
and again, I
Yeah.
think that that does come with responsibility.
Absolutely.
It does come
Yeah.
with the fact that other people might disagree, but
Mm-hmm.
I'm okay if we disagree because then we'll talk
Yeah.
about it and we'll figure it out, right?
Yeah.
Because
Yeah.
there isn't one way to do things, and ultimately, when we work together, we're going to come up with a better solution.
Yeah. Yeah. I really like how you talked about trusting your own strengths. And to trust your own strengths, you have to know your potential, and you have to make sure you're up to date with the clinical knowledge, and being up to date with whatever's going on in your own area of expertise. Because when you are confident in what you know and what your recommendation, for example, can do for a patient, then you're more confident picking up the phone call and calling that doctor and saying, I noticed the renal function is going this way. Can we maybe go down on the insulin dose, or something like that? So you have to really, us as pharmacists and pharmacy students, we have to take responsibility for really staying up to date with our knowledge and trusting the training that we've had, the training and the skills that we have, and believing that it's truly for improving the health of the patient.
Right. And if you're taking care of the patient, you're rarely going to be doing the wrong thing. If it's not about you,
Absolutely.
but it's about the patient,
Yeah.
then surely you're probably going to take the right step.
Yeah. Yeah. Now the meat of the chat of the interview. What impact have you seen pharmacists have on your teams? What impact, advantage do you think it brings having a pharmacist on board?
Yeah. So for me, again, all of the team members are important. When we look at our pharmacy
Yes.
teammates, I think that, one of the things that I find is we have more touch points
Okay.
and we have the ability. So for example, if I want to start someone on insulin,
Yeah.
I can do some of those steps, or my pharmacy colleague could, initiate insulin, titrate
Yeah.
insulin,
Yeah.
titrate up or
Yeah.
down. From a safety standpoint, most people, and again, I work in the diabetes space, they're on 7 or more medicines. Are we really optimizing the safest medications? Specific to Dr. Young and Dr. Wong, they
Yeah.
remind me often, have you really maximized your RAS agent? Are you on the right intensity statin? And again, it's not that I'm not paying attention, but it is really easy to get overwhelmed if you're trying to take care of everything.
Yeah.
And so
Yeah.
knowing that I
Yeah.
have colleagues that have expertise in this area
Yeah.
and are going to improve the safety of the work we're doing together, that to me is huge. And so those are just a couple of examples. But I would
Yeah.
also say that all of our colleagues, every time we have a interaction with the patient, we find out more information. And so, I had just a phone call last week that, hey, actually, this person's not taking their insulin regularly, or they're not injecting in a safe place.
Yeah.
And so those are things that are good for us to know. And if I haven't captured it, but someone else has, we need to address it with the patient.
Yeah. 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 I work at a local county hospital, Contra Costa Regional Medical Center, and we do have a pharmacist run diabetes clinic. And as part of the process, we have a first initial encounter for patients that are referred to our clinic. So the pharmacist calls, and we begin by explaining to the patient why we're not the doctor calling, and why as pharmacists we're calling them to go over the diabetes referral and talk about how we're going to work together in improving the blood sugars. And a common question I get is, I already go over this with my doctor. Why do you have to call me and do this over again? I feel like it's just doing the same thing. And one thing I tell them is that, well, with your doctor, diabetes is a very complex problem, and you need close monitoring. And with doctors, you can have every 3-month appointment time frame, and they may be like 15 minutes long. But as pharmacists here in the diabetes clinic, we can call you weekly or every 2 weeks, depending on how well you're doing with your sugar. So and then we can talk for 30 minutes up to 1 hour. So we have a little bit more time to help your provider and in getting what your blood sugar readings are and adjusting your insulin until you see your provider again. And all the information that we get from you, be rest assured that your primary care provider also sees that, and we work together with your primary care provider. And anything I do, any changes I make, your primary care provider is aware of that. So we assist. We are maybe more accessible, more time to do that. And you also mentioned different lenses, and even within just the pharmacy profession, I can speak to 3 different pharmacists of my colleagues. We can speak to the same patient and get bits of different information, and piecing them together really, really, really helps paint a bigger picture in figuring out what's going on with the patient. And of course, in that manner, we have a better chance of getting their A1C to goal. So,
And I'd love to add 2 things to what you said.
yeah.
So, I think that, there's like more than 8,800 hours or 8,700 hours in a year. And most people with diabetes only have 1 hour of medical visits focused on that.
Wow,
and for a chronic disease, right? 4 visits, 15 minutes each. For a chronic serious disease, that's just not enough attention. Your diabetes deserves more attention than that.
Yeah.
And I would also say that it's very unlikely that if I was seeing a patient and I instituted a plan and I waited 3 months to see if that plan worked, there's a very low likelihood of success. Most things are hard and need more touch points. And then I guess I would say to the patient, one of the reasons why I need you to work with my other team members, including the pharmacy team, is that wouldn't it be great to have your medicines all lined up when you come to the visit with me, so we could focus on your concerns, right? We could talk about the things that you want to talk about, because otherwise we have competing agendas. I need to know all your meds, I need to know all your readings. But if we have those things lined up, we could talk about how you're feeling. We could talk about other things. And so that's where the value comes back to the patient as well.
Yes, absolutely. I'll remember that when I talk to my patients next time. Really, really good information, Dr. Shubrook. So this is going to be, we're wrapping up here, our last question, and it's about, what advice do you have for aspiring pharmacists or new pharmacists in preparing themselves to be more effective members of the healthcare team?
Yeah, so I think that this is an important topic, and I think as medicine changes, the roles have changed as well. So I know that we're going to need pharmacists to be involved in all aspects of our patients' care. And I think if you can feel more confident about patient education, that would be a really great value added. And know that if you're communicating with the other team members, we need you and we need your help. And I think that can include not only optimizing medications, making sure things are lined up, but really making sure people are taking them correctly, make sure they understand why they're taking them. I mean, there are so many gaps in healthcare. And I think that, it's been clearly shown that pharmacy-based chronic disease clinics work. It's been clearly shown when you have a pharmacist on your team, care gets better. So the evidence supports the work you're doing. Just know that you come as knowing as a team member, you're not taking over everything, you're coming as a team member, and that you have value added is probably the most important thing I would want to share.
Absolutely. So I got 2 things out of this. Work on your motivational interviewing skills. And those are things that you can practice in the if you're volunteering somewhere. Touro has a student-run free clinic where we get to speak to patients a lot. So as a student, you can start by doing that and working on talking to patients and getting information out of patient. And the second thing is, as pharmacists, your work, your impact has been shown in evidence-based research. So that should be enough to give you the confidence that you're getting into a profession that is truly going to make a difference. And I think you're absolutely right. Having those two things in mind, having that mindset should give you the confidence to become not only a better pharmacist, but as also a better team member and have a better impact on patient care. So those are two awesome pieces of advice. And that's all I had for you this morning. I thank you so much for taking time out of your day so early in the morning to come on and chat with me. And maybe we'll have more chats in the future, depending on what ideas we get. I thank you so much and have a good rest of your day.
It's been a pleasure. Thank you
Thanks,
very
Dr.
much.
Shubrook. Bye-bye.